As a pediatric chiropractor and one that specializes in craniopathy or chiropractic cranial work, some of the most common questions that I get from parents of infants are about flat spots or their cranial shape. And the most common questions that I get is like, does it look like they will need a helmet? Will it get better on its own? We tried tummy time, but our kids absolutely hate it. Is, the 2-3 minutes that we're able to get, is that enough? Is it gonna stay this way? And so honestly, with most parents having these questions, even if they haven't really asked them out loud to their provider or their pediatrician, the topic of plagiocephaly truly needs to be addressed. The big question is like, what are the causes? How can we get help before it's too late? Unfortunately, most parents, helmets tend to be the only option offered for plagiocephaly or flathead syndrome by traditional medical doctors, your pediatricians, and specialists. However, this approach does not get to the root cause of the problem, nor does it really help with any mobility challenges. The one thing that I've seen in my practice is that if kiddos, especially infants, latch, feeding, head and neck control is not on board, it actually significantly makes it worse and can delay or impact their motor milestones in a bigger way. So in this video, we're going to be able to answer all of your questions specifically surrounding flathead syndrome or plagiocephaly. Primarily, what is it? What causes it? And is a helmet the only way to care for or to treat it? And then also, what are the most natural, effective, and gentle ways to be able to care for a kiddo struggling with plagiocephaly? So please share this video with a mom who needs to hear it the absolute most. Typically, when kids come into my office, especially babies, there's some degree of latch and feeding, some extra tone or tension within their musculature, feeling rigid and tight and extending all over the place, and then colic and constipation and reflux and all of those things that typically come with it. And honestly, the things that parents typically talk about, because their pediatrician sometimes scares them in some ways, but there tends to be increasing concerns about watching for the flat spot, especially if their kids don't like tummy time. And a lot of times what I've seen clinically is around the 3 to 6 month time frame is when pediatricians will start to suggest things of like, oh, there's a flat spot there. Well, maybe we should look into getting a helmet, which scares the absolute crap out of parents. And honestly, especially at that time frame, there's a smaller soft spot that most parents aren't really aware of that starts to fuse and can give the appearance of a flat spot across the back of the head. When we're talking about plagiocephaly, we're really looking at the flatness behind the ear. Flatness at the back part of the head is usually not that big of a concern because that's typically how the skull starts to mold and change. And for most parents that are suggested a helmet, a lot of times these kiddos are faced with movement restrictions of their neck and their jaw and having issues raising their head up in tummy time or even with latch and feeding. And most parents know specifically that the helmet is not going to do anything to help those challenges regardless of what the helmet people say that it will. But, parents really try, and they tell me this all the time, is that they really try to keep their little ones off of their back as much as humanly possible. And a lot of parents, depending on when they come into my office for this, is that a lot of them will even go down the physical therapy route. And for most parents, it's really a gut instinct, and thank gosh that they listen to that specifically, because something keeps telling these parents that there's something deeper going on that's contributing to this flat-headedness. Over my years of practice, I can't tell you how many kiddos that I've seen with plagiocephaly. The worst in my clinical practice was a kiddo over the age of about 1.5 that had closer to a 20 millimeter difference comparatively from side to side. Now, clinically speaking, the helmet providers are typically looking at anything above a 6 millimeter difference from side to side. It used to be 8. They've brought that down now. And this was something that was actually missed by the pediatrician because he probably could have been a surgical case, but that just didn't happen. But in my clinical practice, the worst that I've seen that was resolved exceptionally well was about a 14 millimeter difference. And over the course of a couple months, and she was a little bit older too, she had what's called frontal bossing as well. But one of the things, after a couple of months of us being able to address the cranial component and the neurological component, because those are two very, very heavily tied together pieces to plagiocephaly or flathead syndrome. We got her down to about 3 millimeters of difference from side to side from about 12 to 14, which was actually pretty significant comparatively to her age. But enough about all of that. In this video, we really want to go into the 3 main causes of plagiocephaly. And so, pressure from positioning while they're sleeping or in the womb is the first. So, plagiocephaly is caused by repeated pressure on one part of a baby's skull and is then made worse when babies lie down on their backs or sleep in that same position most of the time. And this is a common occurrence in infants, and the studies show that about 20 to 25% of babies develop varying degrees of plagiocephaly when they sleep on their backs. Plagiocephaly can even start to develop when babies are in the womb if they're stuck in an abnormal position and then their head or their head shape is tightly pressed against the uterus. This is typically in a higher risk. This is at a higher risk primarily with twins or multiple babies when there's even less room within the womb. But the second big part of it, the cause I should say, is something that's called muscular torticollis. And this causes a stiff, stuck, twisted neck, and it limits their range of motion or their movement. And so plagiocephaly can also be talked about alongside with muscular torticollis, which is a condition in infants that causes that stiff, stuck, and twisted neck where the child's head is continually bent off to one side and a lot of times rotated to the opposite way. And this makes it difficult to turn their head and rotate both the head and the neck in both directions, and most commonly, I'd say in about 90 to 100% of these cases, there is a significant struggle with breastfeeding and or bottle feeding on one or both sides of the breast. And so because of this neuromuscular tension and the restricted movement that's caused by the torticollis, it often causes or contributes to plagiocephaly in a really big way. And many children struggle with both of those conditions simultaneously. The third cause of plagiocephaly is birth interventions, including things like forceps, vacuums, or cesarean deliveries, or even manual traction out of the womb space. The big thing here is that birth intervention, such as the use of forceps or vacuums during the delivery, has been associated with an increased incidence of head-shape abnormalities, including plagiocephaly, specifically within infants. There's been several studies that have investigated the relationship between birth intervention and the incidence of plagiocephaly. Specifically, the systematic review and meta-analysis that was published within the Journal of Pediatric Rehabilitative Medicine in 2018 found that the use of forceps or vacuums during delivery was associated with a significantly increase of plagiocephaly than those that were delivered by natural or normal means. And so the big question that parents will a lot of times ask is like, what are the signs that my baby may be struggling with plagiocephaly? And so symptoms of plagiocephaly are pretty straightforward and really include the following things. There's usually a notable or visible flat spot on the side of the baby's head or the whole backside. Usually that will look almost like it'll look, if you're looking at the top of a baby's head, it'll be super, super flat up at the bottom. So if my thumbs are where the bottom part or the back part of the head is, it'll be super duper duper flat, like significantly out through right here, right above and behind where the ears sit, that'll be bulging outward. And usually the frontal bone, or this big bone on the front side, will also be altered in some type of way. And so whenever we're seeing these flat spots on the side or on the back part of the entire head, the baby usually will have less hair on that flat spot on the side of the head because they're always laying on it. And when we're looking down at the baby's head, the ear on the flattened side may look pushed forward. And a lot of times you'll see a big imbalance with the ears and the eyes or other facial features. And a lot of times in some pretty severe cases of plagiocephaly, you'll see that on the opposite side of the flattening, you'll see a big bulging out on the front side or the frontal bone right through here, along with a lot of other facial asymmetries, primarily within the cheeks or even in through the side of the head through here. A lot of times their palate or the roof of their mouth can be altered as well just because of plagiocephaly. And so when we really start to look at plagiocephaly, the condition itself should not be painful for babies. The risk is that they'll struggle to hit their developmental milestones due to the underlying issues with gross motor function, subluxation or stress stuck onto the nervous system, torticollis, and so forth. This specific study shows that those delays could carry on into toddler years, altering gross motor movement, fine motor movement, and their milestones because of the stuck, locked in tone and tension within the musculature that's keeping them there. Additionally, kids with unresolved plagiocephaly could be more susceptible to ear infections and other respiratory conditions. Since the subluxation or stress stuck onto the nervous system, as well as the motion restrictions, limits our body's ability to drain fluid from the ears and move mucus through the ear canals or through the nose, through the respiratory system, and then the lymphatics to then get to the gut and then to our bowels so that we poop it out. So with all of this, there may be a question of like what natural and less invasive options are available to specifically help with plagiocephaly. And so thankfully today, there are so many parents, just as you guys are doing right now, that are exploring other options for plagiocephaly besides traditional medical recommendations of helmet therapy, physical therapy, occupational therapy, and so forth. So we strongly encourage you to keep looking beyond those options until you find the ones that truly do get to the root cause of what's causing plagiocephaly. And so the treatment of plagiocephaly should never require medication or surgical intervention, since the vast majority of cases of plagiocephaly do not involve a condition called craniosynostosis, which is where the plates of the skull are actually fused together, and as our brain grows, the skull will grow in really awkward ways or positions. So most parents are not shocked whenever they look at their neurological insight scans that we use within the office that very clearly show significant stress and tension that's being built up and held within the upper neck, like you're seeing right here. So what the thermal scan does is it rolls all the way up the spine. It uses infrared heat thermometers, cameras to be able to measure the temperature difference from side to side. So what you're seeing up top is a significant pattern of stress to the upper neck. This plays a role with a couple of different things. The vagus nerve is by far the most neurologically compromised structure or function within our entire body. Whenever we have subluxation or stress stuck on the neurological system, up top within the upper neck, because our vagus nerve plays such a big role with our gut, with our immune system, with our ability to rest and calm. And then when kids get older, why the vagus nerve is so relevant is because it plays such a huge role with socialization and then emotional regulation. There's also some components to it when we start talking about sensory regulation or sensory integration and processing within our kids too. But what you're seeing here is a big significant pattern that we most commonly see in cases of torticollis and plagiocephaly because there's so much stress and tension both neurologically and neuromuscularly up within the upper neck that's keeping things locked in and not being able to move correctly. So it's not uncommon that whenever we see big patterns of stress and strain like this, is that their latch and their feeding is not as great or not as efficient as it possibly could be. Why there's so much neuromotor tone or neuromotor tension within the body, and because of its impact with the vagus, why you'll see digestive system issues, primarily with things like colic, things like reflux, and even sometimes constipation as well. So this is one of the most common patterns that we will see within these kiddos that are struggling with torticollis and plagiocephaly. And so parents always ask, like, what can we do outside of the office to help with some of that? And I always share with patients and parents that outside of consistent chiropractic adjustments to be able to address that root cause or stress stuck on to the altered tone and tension within the body and the nervous system, we always encourage ways to support babies at home as well, because this is really important because they're only in the office for a short amount of time and then they go back out into the real world. So the parents need home care options. So number one is always be sure to allow for plenty of tummy time as well as changing into multiple different positions. The biggest one is trying to limit the time that your baby spends in containers. So things like bouncers, swings, car seats, bumbos, all of those things, especially swings because that's a big one. But anything that's going to keep your baby contained and put into a specific position can be a big contributing factor to torticollis and plagiocephaly. And the third is really alternating the side that you hold your baby on when you're feeding, either with breast or bottle, or when you're carrying them. This is also a double benefit for you, mom, specifically, because that hip gets all hiked up, that shoulder gets real tense, and then you guys need to come see me as well. But I digress. Those are the biggest things that I always share with moms within the office because they're the most important when we're talking about how to aid in the process of resolving plagiocephaly. As with all of the babies that come into our practice, as they start chiropractic care, a lot of times parents will start to notice some really significant improvements pretty immediately, primarily with their suck and swallow biomechanics or their efficiency when they're feeding, whether it's on the breast or the bottle. A lot of times their constipation or their sleep really starts to improve. And even so, for those kiddos that do go into a helmet, one thing that I always recommend is that if you are going to go to a helmet and receive chiropractic care at the same time to be able to address this head on, is that the frequency in when you go to get the helmet checked and measured for head shape changes needs to be more frequent than the recommendations that they're going to give you from the helmet specialist. Meaning the changes that you'll see within the head happen faster than what the helmet is going to make. And so in order to stay dynamic with the changes that are happening throughout chiropractic care, I absolutely always recommend to parents to go get the helmet checked out as often as you possibly can, so that way we can continue to push progress with what's going on within the head. And so when we talk about the chiropractic side of it, it's the chiropractic adjustment that gets the nervous system to a healthier place, and it clears out that stress stuck on or the subluxation so that her neck and the jaw and all of the body, the tightness, the overextending and arching could essentially start to release and relax. And that way, a lot of times these babies will start to move easily to allow for the skull to continue to grow and to mold properly. And so the extra benefits or positive side effects that I kind of shared with you above, or earlier I should say, is, latch and feeding or the efficiency with that can improve. So a lot of times sensation of what mom experiences on the breast or how quickly they're downing some of these bottles will improve very, very quickly, as well as bowel movement, sleep, and the overall happiness. So less fussiness, more poops, better sleep, less switching hour, all of those really cool things. And so As I mentioned before, there are so many parents that have these questions, and we're happy to answer them for every single one of you. So our DMs on our Instagram or on our Facebook are absolutely always open. And so for more resources, check out the link in our bio. And then ask any questions in our DMs, leave us a comment, share this with other parents or with other families, and then check out our website for our blog and our articles, because that's going to give you significantly more information, not just about plagiocephaly and torticollis, but all of the things that we care for with kids within our office. So until next time, I'll see you guys soon.